Having knee problems, it could be the result of a meniscus tear. And today we're taking a closer look at the signs, symptoms, treatment, options, and recovery times for this kind of injury. And Dr. Richard Nauert, sports medicine physician with TSAOG Orthopedics and Spine, is here. Welcome, welcome, doctor. For those who may not know, what is the meniscus?
Yeah, so the meniscus is a special type of cartilage within the knee. Each person actually has two meniscus in each knee, one on the inside and one on the outside. We call these the medial and the lateral meniscus. These act as shock absorbers between the knee, but also have a little bit of a secondary stabilization effect as well. And for us, knee meniscus injuries are one of the most common injuries that we see.
Oh yeah, and so what are the symptoms of a meniscus tear?
Of course, yeah, so when thinking of meniscus tears, meniscus injuries, I think it's usually easiest to break them down into kind of two categories.
Okay.
We have acute tears, where someone's doing fine, no issues, and they have an injury to the knee, usually with some type of twist or rotation across the knee. These meniscus tears and injuries can present with swelling, pain, trouble walking and weight bearing. Sometimes people can have blocks to motion where they can't fully straighten out their knee, or they may have clicking and catching. You also have chronic tears, which are no specific injury. People usually notice their knees getting a little bit worse over time. We typically think of this as more of a wear and tear type injury. It can be associated with aging as well. And
so what should someone do if they think they have a meniscus tear, if they're experiencing any of those symptoms?
Yeah, of course. Well, if you think you have a meniscus injury, especially an acute injury, it really is important to get evaluated early by someone that specializes in knee conditions, such as TSAOG. Early diagnosis and treatment really can kind of make all the difference when it comes to recovery and how we manage the injury.
And so how are they treated?
Yeah.
What's the best way to go about it?
So it really depends on the type of meniscus injury you have, if it's acute or chronic, the location of the tear within the meniscus itself, but also the individual person and patient. Everybody's different. Some acute tears are managed with surgical intervention, whether that's with repair or sometimes limited debridement. Other chronic tears may be successfully managed without surgery, with medications, physical therapy, sometimes injections as well. It really just depends.
Depends on the severity,
yeah,
right?
Of course.
Okay. And so how long does it take to recover from a meniscus tear? I would guess depends on the severity as well, right?
Yeah, you nailed it. It's different for every person. And we really take an individualized approach where it depends on the type of injury, the location, and the treatment provided. The good news is, with appropriate treatment, most everybody can get back to doing the things they want to do and regain their full activity without pain.
All right, thank you so much, Dr. TSAOG is your one-stop shop for all your orthopedic needs, from diagnosis to recovery. They have 8 locations in the San Antonio area, and Dr. Richard Nauert is practicing at the Ridgewood and Schertz locations. You can book your appointment by calling 210-804-5400 or visit the website tsaog.com. Doctor, once again, thank you.
Thanks for having me.